Thank you for standing by and welcome to the PAINCHEK Investor Webinar and Q&A following the company's quarterly update announced this morning. All participants are in a listen-only mode. There will be a presentation lasting approximately 20 minutes, followed by Q&A. If you have a question you'd like to submit, please feel free to type it in using the Q&A function on the Zoom app. Please note this session is being recorded. On behalf of PAINCHEK today, we have the CEO and Managing Director, Philip Daffis. I'll now hand it over to Philip. Please go ahead.
Thank you, Matt, and thank you everyone for being here today. Really appreciate your time and I want to talk to you today about the positive progress for PAINCHEK over the past quarter. Before I do, I just wanted to reflect a little bit. I've been in the medical device and diagnostic field for nigh on 40 years now, and I've been very fortunate to work for companies such as Pfizer in their European office for their cardiovascular business. I've worked for Roche in their headquarters in Germany for their diabetes monitoring business, and also with Cochlear, head up the European business out of London for many years before I came out to Australia to head up the global marketing. So when I was putting this presentation together for PAINCHEK, it just dawned on me that PAINCHEK's now getting to a stage which I call is a maturity stage of a business. And what I mean by that is that today I'll talk about the business and the progress, but also talk a lot about the outcomes of what we're seeing and how it's impacting care, how it's impacting pain management. When I look back on my time at Roche and Cochlear, for example, we went through a phase where we started off talking about technology but then moved on to outcomes, and outcomes being things like the diabetes, how do we manage complications, how do we reduce complications? And that's what drove sales and business. With Cochlear was how quickly are we helping people to speak, and are we helping them to actually get work and live their normal lives? And that's what helped grow the business. And what you'll see today from the presentation is that PAINCHEK's also at that sort of pivotal point where the technology is broadly accepted, and it's now more about how it's impacting outcomes, and that's driving partnerships, and that's driving take-up in clients around the world. And I think you'll see that as we go through the presentation today. So what I will cover today is how we continue to expand our business across our sort of core three-pillar strategy, and how we're expanding our marketplace in Australia, UK, and New Zealand in aged care, reaching about a 4.4 million ARR, including both commercial and validated pipeline beds. We've hit more than 2 million pain assessments, which is a significant milestone for the company. And of course, we store them all on our back end. We've got our first commercial agreements in Canada, which we're going to implement this year, along with our point-click care integration agreements. And then, of course, that gives us access to more than 10,000 aged care homes and more than 1 million beds in the United States and Canada. And what I'm going to talk about today as well is the agreement we have now for the hospital sector with InterSystems, and how we're working together to build a unique assessment for managing pain in the hospital environment. In fact, I just got a phone call to them last night about 7 o'clock, so that's all going really, really well. Finally, we'll touch on our progress with infants as well, and how we're looking to go to more of a direct-to-consumer approach. But let's start, we always like to start and talk about the problem we're addressing. And pain assessment is difficult. In fact, it's especially difficult for those people who can't reliably verbalize their pain. And that includes people living with dementia and includes pre-verbal children. And the problem with these environments is that pain is often missed, it's often misdiagnosed, and pain can be undertreated or sometimes mistreated. So our goal and our vision is to give a voice to those people who can't reliably verbalize their pain, and to improve their outcomes and improve their lives and management, and give better tools to their carers to be able to do that. If you look at the market size, it's really significant. I always start with this slide. There's 57 million people with dementia, growing to 150 million by 2050. And people with dementia triangulate really between living at home, living in an aged care facility, and being in hospitals where more than 30%, more than a third of hospital beds are typically occupied with people with dementia. And as you'll see later, they stay there typically significantly longer and have much more risk of complications. Often that's to do with poor pain management. On the other end, there's more than 400 million pre-verbal children out there in the world, and this market size potentially dwarfs the adult size, and we see this as very much a consumer market opportunity, and we're working really right now actually to start putting this in the hands of mums and dads so they can start seeing the benefits of using PAINCHEK at home with their children. That's a project for us this quarter. The PAINCHEK app has been around for a while, but it's really improved. It's significantly advanced where we started back in 2017-18. It has the PAINCHEK core capability in it, which assesses pain for those who can't verbalise. It also incorporates the numeric rating scale system to document pain for those who can reliably inform on their pain level, allowing all carers and all nurses to document pain for everybody in any environment. We also store every single pain assessment. We provide pain charts and information, and those outcomes data helps drive better care management. We've also got open APIs built into this so that it can integrate into resident medical records and drive better care management. And that actually is one of the big drivers we have now, how we improve those outcomes, how we change the treatment paths, and how we get better outcomes for their patients, whether it's a patient in the hospital or whether it's a resident in an aged care facility or a consumer in the home environment. The business continues to grow. If you look on the left-hand side here, as our annual recurring revenue, we're now at 45,000 implemented and commercial beds. So they're implemented and they're fee-paying, and that relates to around 2.1 million ARR. And if you look at our receipts for this quarter, as cash receipts was 549,000, which is roughly a quarter of that total, which shows that that's pretty much aligned. 2.1 million ARR is around $500,000 cash receipts. Cash receipts do fluctuate depending upon timing of contracts, but overall that's looking pretty good. On the right-hand side, though, you'll see really that we've got a stream of ongoing, very close opportunities. We've got the 45,000 commercial paying beds at 2.1. We've got 10,000 other beds which are commercial, in other words, they're contracted, but they're not yet implemented, so we don't actually recognise it till it's implemented. So that will come into the pots. We've then got a mix of ex-government contracts, around 30,000 of those, some of which are looking to transition this quarter, and others which actually taking longer, more of the larger groups to come up fully on implementation, fully commercial, and then comes into our ARR. And then finally, we've got a group of 13,000, which we call our new clients. These are customers that are actually have contracts for signing, or contracts are with them for signing, and there's about 13,000 of those, which we expect to happen very soon. So total that all up together is about 98,000, it's close to 100,000 beds, and the total ARR about 4.4. The importance of that number there is that that 4.4 million, if you start taking out our FDA costs this year, which obviously is an investment, and some of the technology investments making this year, a 4.4 million ARR covers our core Australian operating costs. Just goes to show how good and cost effective this business is. Part of the reason why we're doing well is that we've got a significant number of partners working with us. These are both care management system integration partners and also medication management partners. And this drives part of the outcomes we're going to talk about, because we can document pain at the point of care. We can then have it documented into the care management system and into the medication management system, and we can start to drive new pathways for treatment. Australia, about everybody in Australia is integrated with us effectively. UK, we've got the large majority of those partners integrated, as is New Zealand. And now in North America, we've got AliaCare, Point-Click Care, who cover more than 50% of the aged care market. And InterSystems are a global company. They're based in North America, they're hospital focused, but they're also, of course, in the UK, European Union, and very strong in Australia. So the InterSystems partnership is more hospital focused, while the other partnerships in here are more aged care focused. And I'll come on to the relationship with InterSystems soon. Important thing about this is that in the aged care alone, those partnerships give us access to close to 1.5 million aged care beds. So we're talking about 100,000 beds today. These partners give us access to 1.5 million. And some of them are already looking to become resellers for us, especially in the UK, where they're going to their own clients and they're bundling PAINCHEK into their system. That's relatively new, but that's the way we're starting to operate more and more with our partners. So just wanted to touch on the KPMG outcomes, because in Australia we had the government funding and we submitted a report to the federal government, which was done by KPMG. The detailed reports looked at the outcomes of the work. The detailed report is with the government now, and this is some highlights of that report that we're allowed to share with you, and it's going to be on our website so you can read the full amount. So very quickly, we rolled out in December 2019, and due to COVID, of course, it got delayed, the whole program, and it finally ended in 2022. KPMG did an independent evaluation, and it's quite interesting because more than 50% aged care facilities participate in the rollout, and more than 62% of people with dementia were involved, and more than close to 5,000 aged care staff were providing education and training by our consultants. So that's over that close to 1.5 year period. Now, the evaluation provided many important details. The biggest things in here is the things we've discussed before, and you'll see commonalities now between here and the UK and other markets. So key benefits: ability to identify pain, better understanding of how pain manifests with dementia during the dementia and cognitive impairment journey, and how it can improve resident health outcomes. And one of the biggest messages we got from this process is that with better pain assessments and better pain management, it reduced the pain burden over time, reducing the actual pain levels for most of the respondents. So very positive outcomes in terms of pain management, and also in terms of changing treatment pathways and including changing medication prescriptions. If I give 3 examples, there's 3 examples that came out from the process. And again, this will be very consistent with what we've seen in the UK. First thing was, identifying patients with challenging behaviours they thought was caused by dementia, but actually was caused by pain. And therefore, once understood it was pain, they changed they gave analgesia and actually changed the behaviour and changed the outcomes. The middle case was about when a patient was being given psychotropic medication, which obviously is dementia, aggressive dementia behaviour related. When again, it was found that actually the patient was the resident was actually in pain. They changed the diagnosis, the GP changed the prescription and changed it to a pain relief, which changed, again, the agitation, improved the quality of life. And finally, the third one is about really realizing that some patients or some residents were in pain, but that wasn't identified in the first place. And this case here talks about a UTI, urinary tract infection, changed the behavior. It was actually causing pain. And once we treated the pain as well, then that changed the behavior and changed the medication. So you're seeing how the impact of better pain management is positively impact care. And that's what drives behavior, and that's what drives take-up within an aged care or a hospital facility. Switching now to the UK, and I want to focus most of the rest of this talk really on our international side, because international business is growing quite rapidly. We've now hit the 10,000 bed mark in the UK, 6,500 beds live, and a very strong pipeline. The work in Scotland and Wales government funded is actually going really well. And just literally last week, we had a presentation from the Scottish Care Inspectorate. And in their early assessment using PAINCHEK, what they've seen is, this is not reportable yet, or not documented yet, but they've seen a 22% reduction in analgesic use, a 24% reduction in laxative, because if you take strong opioids, it causes constipation. So a 24% reduce in laxative. But the most important thing they've seen is a 75% reduction in falls, because pain can be a leading indicator to a fall. And of course, as we know, a fall in an aged care facility has significant impacts. We've got, moving on, we've got very good integrations with medication management systems and care planning systems. And again, most of those are pure integrations, but some of them are starting to look at doing reselling for us and selling directly to their client base. New clients include AdvantiCare and National Care Consortium in the last quarter. And again, as I mentioned before, a very strong pipeline. I want to again move to some outcomes data from the UK. I covered this broadly last time, but let me just touch on it again. This is a really interesting case study. Also, this will be a publication, a publication that comes out from Orchard Care. They noticed a 100% increase, significant increase in pain management in terms of their frequency of pain assessments and increased usage. But more importantly, on the right-hand side, they saw a 33% reduction on antipsychotic use, similar again to what you saw case studies in Australia, a 29% reduction in benzodiazepines, and benzodiazepines are depressant drugs, and a 90% reduction in safeguarding reported incidents. So this is a really great piece of work done in the UK, which is influencing the UK market. In terms of the US, reported last quarter that we signed an agreement with Point-Click Care. There are something like close to 2 million aged care beds in North America, and Point-Click Care is the leading care management provider with more than 1 million beds in the US and Canada. That's pretty significant. That's more than 50%, significantly more than 50% of the market. And we do already have 2 agreements now in Canada to go ahead where we have regulatory clearance. Once the integration is complete, we'll be starting that in Canada. And of course, we'll be attending some of the Point-Click Care conferences this year to build the communication with our aged care facilities, getting ready for FDA clearance. I touch on this is on FDA clearance as well. This gives you a view of the overall map of our access now. As you can see, it's increasing. We've covered Australia, New Zealand, we've covered the UK. Japan, we now have a consultant there working with us, and we've got 2 major hospitals looking to work with us to establish regulatory clearance and for hospital potential usage. And again, that could be very helpful with our intersystems relationship. In Canada, I've mentioned we've got those initial sales, and we'll be exploring new sales this year as we have regulatory clearance. And in terms of the US, just last week, we had a call with the FDA, a really positive call. They've approved our clinical trial program and the process, and that's now underway. We are still targeting Q4 this year to have regulatory clearance under de novo. And of course, we'll have then the full Point-Click Care integration established and ready to commercialize to a significant number of residential aged care facilities. On top of that, obviously InterSystems are a US company. So as we look to get into the hospital market, that will also give us access to the hospital market as well. So I think you can see from this, PAINCHEK'S becoming a global business, not just a local residential aged care business. Talking about the hospitals, I just want to again talk about the opportunity here. Pain is a significant issue that needs to be managed in hospitals, especially for dementia patients. They typically stay in hospitals 18 days longer than the majority of patients. Because of the inability to communicate effectively post-operatively, they've got a 3 times increased risk of delirium. And if you have a delirium in a hospital, you end up in intensive care, which is a very expensive bed. And plus it's poor management. And they typically use significantly more antipsychotics due to the dementia. So our agreement with InterSystems is actually sort of twofold. They are a global business, and they're an interesting business because they are one of the world leaders, middleware for hospitals. And what middleware does is it takes all the information from the point of care, all the major vital signs like blood glucose, blood pressure, temperature, pulse, all those vital signs. It takes that information that's recorded at the point of care by the patient and documents it and sends it into the electronic medical record. They've got 1 billion healthcare records globally, and they're one of the leading partners here. So we've got an integration agreement with them for the hospital sector. And as I said before, we work with them both on workflow and medication management. The agreement covers all our products, the adult and the infant, and we see this partnership as the route to the hospital market for infant technology as well as the adult products. They're also interested to work with us in home care and other markets where they're also present. So the other thing about InterSystems is they are the middleware provider. They collect all that data, but they also have a company they own called TrackCare. And TrackCare are one of the leading electronic medication record management companies that store all that data and where that data is assessed and utilized to drive better care. And TrackCare are located mostly around the world with more than 100 million patients covered in hospitals. So what are we doing? Or what's our goal? Well, our goal is really simple. Our goal is to make PAINCHEK the fifth vital sign. 30 years ago in America, they said pain should be the fifth vital sign. To be clear, the 4 vital signs in hospitals are respiratory, blood pressure, temperature, and pulse. We all know those vital signs. They wanted pain to be the fifth vital sign, but they couldn't put it into place because pain assessment wasn't mature, wasn't available, and was very ad hoc. We've got the opportunity now to build PAINCHEK with our adults, our children's, and when the disability product comes along, which we're working on as well, into this sector. And by integrating it into the clinical workflows, we can provide those key benefits. We can provide an early warning alert for physicians to assess a deteriorating patient. Pain's an indication of deterioration. We can help reduce the risk of a delirium post-operatively, say after, hip operations, and better pain management post it to stop the delirium happening. And of course, we can optimize therapeutic treatments to ensure that patients are best managed and managed in the hospital and can leave hospital in the appropriate manner. Now, as mentioned, as of this week, we've now got 3 of these clinical workflows completed now with InterSystems. We've identified a major hospital group in the UK who we're talking to, and we'll be looking to meet with them in the next weeks to pilot test this scenario in this quarter. If this all goes to plan, then we will have the basis for a hospital product to roll out in multiple markets. So finally, corporate summary, market cap around 40 million and cash in the bank of just under 5 million, and a good set of shareholders, including board and key staff. And finally, from my standpoint, look, just to reiterate, we've got a good position in Australia, and it's going to continue to develop and grow with time. We've got a good ARR, which is getting closer and closer to managing our daily business costs and our operating run rates. We've got good expansion internationally with a number of integration partners, as you see. That's a magnificent performance by the team. We're now moving on the right-hand side to good outcomes, very good outcomes for patients, and those outcomes are the things that will drive take-up. It's more than technology, it's about outcomes, and we're getting lots and lots of that data now. Children's app, we're going directly to the consumer now. It's an initiative we're doing ourselves, and we're also integrating it to the hospital with the InterSystems agreements, and those partners are all giving us some significant large global market opportunities. So I'll just hold it there for the moment and hand back to Matt.
Thank you, Philip. We'll now move on to the Q&A session. The questions are based on those sent through via email and using the Q&A function within Zoom. So if you do have a question you'd like to submit, please feel free to type it in and submit it on your screen. The first question we have is, regarding receipts from customers, how much has PAINCHEK received in the last 12 months, excluding monies received from the government grant revenue?
Thank you. Good question. By the way, we received no money from the government grant revenue the last 12 months. That finished on the 30th of June 2022. Well, the program finishes 2022, but we received no additional revenue since then. Revenues we've received, direct cash revenues from our clients, is 1.8 million, which actually is on that same curve you saw earlier on the ARR route. So 1.8 million in cash receipts directly from customers, and the last quarter you saw was 549,000.
Thank you. The next question is, how is the Boots Walgreens deal going?
Okay, yes, we have been talking to Boots, Walgreens, since I was there in September. I presented to them, to the whole management team, to the whole team. Look, they have reseller agreements with a number of care management and medication management systems. They're keen to do an agreement with us. It's in process. It's with their legal team for final reviews. So yes, we're waiting to hear back from them, but it's a partnership we're looking forward to. And of course, if it all goes to plan, they have access to 50% of the aged care market in the UK. They provide medication management to 50% of the aged care facilities. And of course, Walgreens are a US-based company, so we'd love to sort of see if we could work with Walgreens. Nothing's finalized yet, but you know, we've been talking for 6 months together, and we think we're getting close to finalization.
Thanks, Philip. No, the next one is, why did the Philips Healthcare collaboration not materialise when it was quoted as ready to jointly execute post-COVID?
Yeah, look, it was, to be frank, I left Philips December 2019 and had agreement to go back to them, see them in March 2020. Then COVID broke out. That they had the worst of it. They closed down their offices. They remember they supply ventilators to large chunks of the market around the world, and they supply intensive care monitoring. They basically went back to basics, and therefore all new opportunities died at that time. And they've gone through tough times. They've had some ventilator recalls in the US. And you know, if you read the Philips website, their #1 goal this year is sorting out their ventilator problems in the US. And with the FDA and sorted that. So, however, what I would say is our agreement with InterSystems is actually more important. It's more important to have an integration with them because we have the point of care technology. InterSystems have the middleware and the EMR systems to document it all. So that's actually critical. And eventually they also have a relationship with Philips InterSystems because they provide connectivity to some of their systems. So once we get into system working well, we may come back to Philips as well, but through the InterSystems route as part of their relationship with them in hospitals, rather than trying to do it directly ourselves. And it may make it easier, but let's do one step at a time. I want to get InterSystems working really well, and then we'll come back to look at that Philips joint opportunity.
Thank you. The next question is, what money is coming in from the CMS partnerships?
Yeah, that varies actually. Most CMS partnerships, we do the selling, we take the full revenue, and we give them up to something like a 10% cost for maintaining and managing integration. That's what mostly happens. So sometimes we don't provide anything. Sometimes just do it as a free of charge service for us. A few of them now are starting to do reselling. It's still in the early days, but we are booking some reselling opportunities with our UK partners. And again, if we did the Boots deal, that would be all reselling, because they would be selling themselves to aged care facilities, and they will be taking their own margin in that process.
Thank you. The next question is, with PAINCHEK now being a mature business, how will we see revenue? How will we see growth in the value of the business?
Sorry, can you repeat the question, Matt? I didn't hear the first bit.
It was, with PAINCHEK now a mature business, how will we see growth in the value of the business?
Yes, look, I think, you know, we are also disappointed with the share price where it is today. We believe, obviously, like all companies believe their company's worth more than it is. But I think that, you know, if we continue to deliver on the sales in Australia, we're doing, and as we expand into those markets, so the UK growth, the North American growth, and as we get FDA clearance this year, I think will be an absolute game changer, because suddenly then we're in the largest market in the world. We have a patented product in the United States. We have a unique position there. We've got we've got two great partnerships, InterSystems and Point Click Care, and I can see that taking off. So, you know, that's all scheduled for late this year, and I think all those will drive value in the business. And again, look at those outcomes. I would seriously, you know, say to people, if you don't get good outcomes, good clinical outcomes from your products, you don't really survive in healthcare. If you can show outcomes, you will do well. And the reality is that we're in a unique position to do that right now with our leadership in the products and our technology.
Thank you. The next question is with regards to the cash position and how far that sees the company go.
Yes, cash position. So I think about 5 million. 5 million currently in cash. We obviously our sales and revenues are accelerating, which is positive. And look, that will take us for at least 2, maybe 3+ quarters. And then look, the next 2 quarters we're looking to accelerate sales and also accelerate partnerships. So well, we're likely to do a capital raise sometime this year. We may well have to. But if we do, we know we've got a good business, for a good base of business, and we've got some good support from our existing and shareholders, and also from our partners who also came in last time and raised capital. So I think the business is secure, which is great, and I think we've got enough cash to take us through to achieve some of these key milestones over the next 6 to 9 months.
And the final question I've got is, what revenue would PAINCHEK need to achieve full revenue neutral position for the whole operation, both in Australia and globally? Yeah,
well, it's a good question, and we are sort of looking at that. I mean, if you just, the issue for this year, we're investing in the FDA work, which is $1 million plus, and we're also investing in a technology upgrade, which is about $500,000, a bit more maybe. So if you take that out, as I said before, 4 million gives us a core cover for our core operating costs, Australian based. And I think we looked at the UK and said we get to 25,000 beds around that level, then that covers our core UK costs. And then of course from there, it's as you expand into new markets, do you have to fund it ahead of the curve, or can it be self-funding? Depends upon whether you set up partnerships, distribution, or whether you do it yourselves. So what I would say is that it's very rare for a business to be able to operate on an effective business to operate $4 million per annum. As its core function, and that I think shows the fact that we're digital and we can supply, we can sell, we can train everything digitally, and our goal is to really make that part of our unique servicing. Because we can do that, then we can have, like I did at Cochlear, you can have 3 regional hubs around the world, time zones, and you can service multiple markets from those 3 hubs, and that will be a very, very cost-effective and efficient business model.
Thank you, Philip. I'll just hand it back to you to provide a closing comment before we wrap up.
Well, thank you, Matt. And look, thank you everyone for your time today. I was very excited to talk today because I do believe we're at that cusp of getting from a technology discussion business to an outcomes company, an outcomes business. And that's what I believe drives the business forward and gives you the longevity of the business. We're doing well with our core business. We've got some great partners, both in aged care, in hospitals, locally and overseas. And me personally, I see myself spending more time this year overseas as well to support the European expansion and to support that entry into the US market later this year and to optimize where we are in Canada. Our team's doing a great job. I want to thank the team. They're really doing a fantastic job. We're only 25, 26 people. It's a small company. But they're really punching way above their weight and delivering some great outcomes. Also like to thank the shareholders for supporting us. I would also say to people, please, your support is fantastic. It's very valuable, and I hope we've covered today gives you confidence that we are not just delivering on our core business here, but we are becoming a truly global outcomes business.
Great. Thanks, Philip, and thanks to everyone for your attendance and questions today. That concludes the session, and we look forward to seeing you next time.
Thank you.